Well, state health officials say thousands of Wisconsinites may be living with hepatitis without even knowing it. To coincide with Hepatitis Awareness Month and a national goal to eliminate viral hepatitis by 2030, the Wisconsin Department of Health Services is putting out a new statewide plan today. While new state data shows some vaccination targets are already falling behind. State health officials are rolling out a new plan to eliminate viral hepatitis by 2030.
Not only for Wisconsin, but this is also a national and worldwide goal to eliminate viral hepatitis.
Officials say one of the biggest challenges is that many people may not even realize they're infected.
But for hepatitis C specifically, we estimate there's about 47,000 people living with hep C in Wisconsin, and about half of those people don't know that they have it.
As part of the plan, the DHS has launched a new public dashboard showing where the state is making progress and where it's falling short. The dashboard breaks down data for hepatitis A, B, and C, including infection rates, screening, vaccinations, and even deaths. Right now, the data shows mixed results. Acute hepatitis C cases have dropped since 2019, but several hepatitis A and B vaccination goals are still listed as not on track to meet 2030 targets. Updated screening guidelines and new treatments are also changing what health officials say is possible for patients.
There's been newer recommendations for screening guidelines. Some came out in 2020.
And Mitchell says newer medications can now cure most hepatitis C cases in just a few months.
And so now is really the best time. People can get cured in about 8 to 12 weeks with an oral medication for hep C.
Mitchell says even if Wisconsin doesn't completely eliminate hepatitis by 2030, reducing infections, increasing vaccinations, and getting more people screened earlier would still be a major win for public health. The dashboard will be updated every year as the state tracks whether it's actually making enough progress to reach its 2030 elimination goals.